Some women experience pain during sexual intercourse, and while this may not be the case for every woman, for some women, this may just be a sign of infertility. In today's video, I'm going to be telling you some of the common causes of pain during sexual intercourse that may be a sign of infertility, that may be the reason you are not getting pregnant yet. But guess what? I'm also going to be telling you what you can do to prevent this and also the solutions. So if you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything women's health and fertility. Now let's talk about the basics. How does pregnancy occur? Pregnancy occurs when a sperm meets an egg and then fuses together to form a zygote, which travels all the way into your uterine cavity to implant on the wall and then form a baby. Then after 9 months, a baby is born. And for this to occur naturally, it has to be between a penis and a vagina during sexual intercourse. So some of the common causes of infertility is anything that prevents the sperm from meeting the egg, or anything that prevents the already fertilized zygote from getting into the uterine cavity and implanting, or anything that prevents the production of quality egg or quality sperm. So now you're experiencing pain during sexual intercourse. Sexual intercourse is supposed to be pleasurable without pain or with just minimal pain. But when you're experiencing severe pain, probably on penetration of the penis into the vagina, or after the penis has penetrated the vagina and has gotten deep into your cervix. So one of the common causes of pain during sexual intercourse is what we call PID. Pelvic inflammatory disease. Now, PID simply occurs when a sexually transmitted infection has ascended all the way from your vagina into your cervix, into your uterine cavity, then your fallopian tubes, and sometimes even gets to your ovaries. And the commonest sexually transmitted infections that cause PID include chlamydia trachomatis and gonorrhea. A lot of you are more familiar with gonorrhea, but guess what? Chlamydia trachomatis, popularly called chlamydia, is actually the commonest cause of sexually transmitted infections, followed by gonorrhea. So these two sexually transmitted infections, usually they are asymptomatic. That is, when you have it, you might not feel any symptom. You might not have any symptom. But when you do have symptom, it may present as pain during sexual intercourse, a yellowish greenish vaginal discharge, a foul smelling. It has like really bad odor, vaginal discharge, and then bleeding in between your periods. And then, of course, infertility, that is, inability to get pregnant. How do you get a sexually transmitted infection? It usually happens when you have unprotected sexual intercourse, whether it's vaginal or anal. So when you have a sexually transmitted infection, or when you have sexual intercourse with someone that is already infected, and you do not treat yourself, and you contract this infection, and you don't treat yourself early enough, this infection can ascend. It can go into the cervix, into the uterine cavity, into the fallopian tubes, and sometimes to the ovaries. So the idea is to get treated early, because there is actually a treatment for it. Because if it is not treated early, within days to weeks, it can actually progress to pelvic inflammatory disease. And when this occurs, what happens is the bacteria causes inflammation in the fallopian tube, in the uterine cavity as well. So when the inflammation is healing, like it's just like an injury in the fallopian tube. And when this is healing, it heals with a scar. And when it heals with a scar, it blocks the fallopian tube. And remember that I said that pregnancy can only occur when a sperm actually meets an egg for fertilization to occur. So if the fallopian tube is blocked, the sperm will not be able to pass and get to the egg, because you know what? Ovulation, which is the release of a mature egg from the ovary, usually releases that egg into the fallopian tube, and it goes somewhere in the fallopian tube to wait for the sperm to come and fertilize it. Now, if this sperm is unable to meet the egg because the tube is blocked, then fertilization will not occur, and this is how infertility occurs. Sometimes this injury that the bacteria from the sexually transmitted infection causes in the fallopian tube, it may not be complete blockage. It may actually be incomplete, like partial blockage of the fallopian tube. And in this case, the sperm may be able to actually find its way to the egg and fertilize the egg. But what happens when the fertilized egg, the zygote, is trying to travel through the fallopian tube to get into the uterine cavity where it's supposed to implant? Usually that is supposed to take 5 to 6 days. That is the travel of the embryo, the travel of the zygote through the fallopian tube into the uterine cavity is supposed to take 5 to 6 days. But then again, because there is partial blockage of the fallopian tube due to the scarring, the injury in the fallopian tube as a result of the STI, these zygotes, this fertilized egg, will now take more than 5 days, and sometimes it's still in the fallopian tube on the 9th day or on the 10th day, and then it ends up implanting in the fallopian tube. Now, the fallopian tube is not the same material as the uterine cavity. It is slimmer, it is softer, it's not built for implantation. It's not built for an embryo to implant on it and for a baby to grow. I mean, it is a tube, right? So what happens is when this embryo implants in the tube, then the baby starts to grow, the embryo starts to grow. And at about the 9th week of gestation, this embryo, this fallopian tube will rupture. So ectopic pregnancy just simply means ectopic is like ecto is outside. So it's like pregnancy that is occurring outside of the uterine cavity. Now, you remember I first told you that the first way PID can cause infertility is when it prevents the sperm from actually meeting the egg for fertilization. The second way is ectopic pregnancy. And when ectopic pregnancy occurs, the treatment is actually surgical removal of that fallopian tube that the rupture occurred in. So PID is actually common in young women, is more common in younger women less than 25 years old. So how do we prevent this? This does not mean that if you're older than 25 years old, you cannot have PID. You can, but it's just that it occurs more commonly in younger women. Now, how do we prevent PID? Number 1, avoid having multiple sexual partners. Number 2, make sure you use a condom during sexual intercourse. Even if you're on other forms of birth control like hormonal birth control pills or IUD, still use a condom for protection, because those other forms of birth control just help you to prevent pregnancy, but it doesn't prevent transmission of a sexually transmitted infection. So always use a condom. And also, if you're not going to be using a condom during sexual intercourse, maybe you're married or you have an agreement with your partner, ensure that your partner doesn't have other sexual partners. So these are the ways to actually prevent a sexually transmitted infection and thereby preventing PID. There's also treatment for this. Like I mentioned prior, I said you need to get treatment early. So once you've been diagnosed of sexually transmitted infection, whether it's gonorrhea or chlamydia, you need to start on antibiotics treatment immediately. So there's actually a treatment for this. And when you treat it immediately, it prevents complication. It prevents ascension into the upper reproductive tract, and then it prevents infertility. Now, there are other causes of PID, right? It's not just the sexually transmitted infection. So some women, in an attempt to wash their vagina, they douche. So douching is simply using a mixture of chemicals in water, then putting it in a pump that has a nozzle, and then squirting this liquid up into the vagina in an attempt to wash the vagina. Your vagina does not need to be washed. It is a self-cleaning organ. Your vagina is a hollow organ. You can't actually see it. You can only see the opening of your vagina. But what you see is your vulva, and it's your vulva that you're supposed to clean with, of course, just lukewarm water and unscented soaps if you must. But using water down there is just enough. But when you decide to be overzealous and go into the vagina to attempt washing it using harsh chemicals, harsh soaps, douching, then it can actually introduce the bacteria all the way up, take it all the way up, and then it will now ascend into the upper reproductive tract. That's your uterus, your fallopian tube, and cause PID. So, my women, we should really refrain from washing the vagina because the vagina cleans itself. Okay, so I should have talked about how you get diagnosed before how you get treated, but that's okay. So you get diagnosed. When you go to your healthcare provider will do a pelvic examination for you. And this includes you lying down with your back on the examination bed and raising your legs up. Of course, there's going to be a prop for you to rest your legs on it. And then a speculum will be gently passed into your vagina in an attempt to evaluate, to examine your cervix. So while your healthcare provider is going into your vagina, it can also elicit pain. So we can also tell that, there's pain in your cervix. And then a fluid will be taken from your cervix to be tested. Also, some blood tests can be gotten from your veins to be done in the lab. Also, an ultrasound scan can be done. Sometimes there are some things we see on an ultrasound scan, like fluid in the pouch of Douglas, that may signify a PID, but it doesn't always signify a PID. So when we see that, we now add your history, your gynecological history, or what did you present with? What did you come here for? And then we might have an idea that, this fluid we are seeing in the pouch of Douglas, is a sign of PID. So good news, guys. There is a treatment for PID. You just need to get treated early. Another cause of pain during sexual intercourse that may be a sign of infertility is what we call endometriosis. Endometriosis is simply when the lining of the inner part of the uterus is found on other pelvic organs. So usually what happens during menstruation is the lower third of your uterine lining sheds every month and comes out as period blood. Now, when this uterine lining is not found in the right place it's supposed to be, which is inside your uterus, and is found outside your uterus on other pelvic organs, the lining in your pelvis, your fallopian tube, your ovaries, your cervix, then we call that endometriosis. So now when you have endometriosis, this can also cause pain during sexual intercourse because endometriosis is like an inflammatory disease. It makes the cervix, it makes the uterus inflamed. This is one way it can cause pain during sexual intercourse. Another way is sometimes these endometrial tissues that has already migrated to different places might also be in your lower uterus, like your cervix area. And then when the penis is penetrating the vagina, it causes pain. Usually the pain that comes with endometriosis is actually deep penetration pain. And we call this deep dyspareunia. So dyspareunia is just the medical term, for pain during sexual intercourse. So what are the common causes of endometriosis? The exact cause of endometriosis is not known. But then studies have shown that endometriosis can be genetic. That is, it runs in some families. And then some other studies have shown that, it's a result of hormonal imbalance. And some say it's a result of retrograde menstrual flow, which is when your menstruation, that's the blood that is supposed to be coming out of your uterine cavity through your cervix, through your vagina and out, might flow backwards a little bit into the fallopian tube. So when it's flowing backward a little bit into the fallopian tube, some of the endometrial tissue might get stuck in the fallopian tube and cause blockage in the fallopian tube. So how do you know that you have endometriosis? So endometriosis is usually symptomatic and it presents with painful menstruation. For some women, this pain is debilitating. In fact, for most women with endometriosis, the pain is debilitating. It's so severe that it affects them from going about their daily activities. And one of the causes of this pain, this severe pain, is that, remember I said that this endometrial tissue that is supposed to be in the inside that usually sheds during menstruation is found on other pelvic organs. So now, during your monthly cycle. And this uterine lining is shedding, the one inside, wherever the endometrial tissues are found, are also contracting and shedding. And this is actually causing severe menstrual pain. So if this is you that has severe menstrual pain and you have not been diagnosed or you have not been evaluated, so you need to see your healthcare provider to get evaluated. Now, for endometriosis, there's no definitive treatment, but there is management for both the pain and then the endometrial tissues that are found in other places. So management of the pain can include ibuprofen, diclofenac, or any pain med that actually helps to relieve the pain. But sometimes these pain meds may not be effective. In that case, you actually have a conversation with your healthcare provider about introducing oral contraceptive pills. So many studies have shown that oral contraceptive pills helps with the pain that comes with endometriosis. There is also this injectable medication called GnRH agonist, and this one is like a shot you have, but it lasts you for about 3 months or about 6 months. And what this does is that it helps with the pain, it helps to shrink those endometrial tissues found on other pelvic organs, and it also prevents menstruation for the period that it is effective. There is also the treatment option for surgery, but it's not like a major surgery. It's actually a laparoscopic surgery where we make a pinpoint incision in your lower abdomen to go all the way to your pelvis to check what is going on there. And when we see this endometrial tissue, we cauterize it. That is, we burn the tissues so that we reduce the amount of endometrial tissues in other areas that are not your uterus. Studies have shown that getting pregnant with endometriosis is a lot more challenging than when you don't have endometriosis, but it is possible. And then you can actually get pregnant with endometriosis naturally. Even though this may be more difficult than, of course, if you don't have endometriosis, but it's possible. All you need to do is, let's start with being on OCPs or being on the GnRH agonist for a period of 3 to 6 months, because we are trying to reduce inflammation in your pelvic area. Then when your period resumes after this, you can consider tracking your cycle. I have several videos on how to know your fertile window so that you can know the right time to have sexual intercourse to increase your chances of getting pregnant. So when you track your cycle, it helps you know when you're most fertile. So usually for women with endometriosis, we advise you to try for a period of 6 months. And if within these 6 months you don't get pregnant, then you can come into the clinic for evaluation so that we can talk to you about other options. There are other options like in vitro fertilization, popularly known as IVF. IVF is simply taking the egg from the woman, taking the sperm from the man, fertilizing it in a dish outside of the body, and allowing this embryo to grow for about 3 to 5 days in an incubator, and then transferring the resultant embryo into the uterus of the woman. Now, with endometriosis, one of the things that you need to know is that sometimes they have poor egg quality. And if this is the case, you can always tell when the eggs have been retrieved and you see it under a microscope. In that case, your healthcare provider may advise you to get a donor backup. So what this just simply means is you get a younger lady that has all her fertility parameters normal, and then you actually retrieve her at the same time that we are retrieving you as the client, just in case your egg quality is not good enough. Then you have a backup, just so that whole cycle is not cancelled. This increases your chances of getting pregnant. So the last cause of pain during sexual intercourse that actually might be a sign of infertility that I'll be talking about in today's video is vaginal dryness. Now, there are several causes of vaginal dryness, but I'm going to be focusing on menopause. Now, when a woman is about 45 to 58 years old, she may be experiencing menopause, which is no more menstruation. And when this happens, it means that estrogen has significantly reduced in the body. And when estrogen significantly reduces in the body, it can lead to vaginal dryness. Now, when the vagina is dry and the penis is trying to penetrate the vagina, it could cause tears around the orifice, the opening of the vagina, and can lead to pain upon penetration of the penis into the vagina. Now, how does this cause infertility? When you're menopausal, you no longer ovulate. And when you no longer ovulate, remember I said fertilization, pregnancy can only occur when a sperm meets an egg. So if a woman no longer releases a mature egg, then a sperm cannot find any egg to fertilize. So that is the simple reason why a menopausal woman experiencing pain during sexual intercourse may not be achieving pregnancy. If you've learned something today, if you've enjoyed this video, share with your friends. Don't forget to like and subscribe, and see you in my next video.